Is racism a public health threat? Backers of a bill declaring that say yes, pointing to other states, the American Medical Association, even the CDC, which have all said yes, it is. Local 24 News reporter Jenny DiPrizio on why Tennessee lawmakers decided to put that issue on the shelf.
It's our moral duty to ensure that all Tennesseans are treated equally.
Tennessee State Representative Antonio Parkinson says COVID-19 has lifted the veil on healthcare disparities for people of color, which is why Parkinson proposed a bill declaring racism a public health threat. Seemed simple enough, said Parkinson, but to his surprise, getting Republican lawmakers to pass it wasn't so simple.
I find it is unjust to imply that there is systemic bias and systemic racism within my profession. I feel that is very unfair.
Tennessee State Representative Sabi Kumar spoke against it during this committee meeting. The Republican doctor from Middle Tennessee told lawmakers while he believes there are inequities, he says other factors like pre-existing conditions could be connected to genetics or socioeconomic factors, not racism.
I don't think that's because of racism. I really don't think.
Kumar and the majority Republican group of lawmakers voted to move the bill to summer study session, avoiding a vote.
I would not have expected opposition from people in our legislature.
Dr. Latonya Washington is the president of the Bluff City Medical Society.
Racism certainly is a public health issue, and I would consider it a public health emergency at this point.
Washington says lawmakers and the public need to first recognize there is a bias in the healthcare system, adding it won't be overcome until the issue is dealt with head on.
It's not something that we will say that we want to get better and then magically it gets better. It's really going to take a lot of boots on the ground, a lot of changes so that healthcare can be equitable for everyone.
One thing I know about being in the Tennessee legislature is that having conversations around race is extremely uncomfortable to a lot of people.
Parkinson says lawmakers may have pushed the bill to summer study session, but it's an issue that won't be going away.
We have to be comfortable enough in the beginning to at least have the conversation so that we can begin to right the wrongs and make sure that every Tennessean is receiving the adequate health care that they deserve.
Jenny DiPrizio, Local 24 News.